Hello, my name is Christian Nogamba. I'll be doing my video validations on doing a bed bath for Nursing Foundations class, section 602. To begin, we're going to start off by reading the 7 steps that you should do before interacting with your patient. Our first things first, we're going to check the physician's orders, make sure that I can move this patient. Next, we're going to identify the patient with two identifiers. So in this case, name and birthday, or you can use the hospital ID band with the MR, patient's name and date of birth. We're going to introduce ourselves to the patient. We're going to provide privacy, explain the procedure, gather our equipment, and perform hand hygiene and don gloves if necessary. So to begin, we're going to offer our patient, if they need the urinal or bedpan, but in this case, my patient doesn't. So we can move on to our next step. We're going to raise the bed up to a working position, and we're going to adjust the head of the bed if the patient wishes to do so.
It'll be smoothed out.
So in this case, our patient doesn't want the head of the bed raised or lowered. She's comfortable the way she is.
Okay, ready?
Our next step, we're going to put on gloves.
Second, we're going to have a draw sheet. For all layers that will be on the bed, it'll be the same procedure.
Okay.
Make sure they're
smoothed
out.
Put it down. Put on lower the top sheet.
How you feeling there?
Just like so.
Fine. That's great.
I'm going to put on the bath blanket.
Also approach my patient with a
The purpose of the bath
drop
blanket
to
is
make
to
sure
keep our
that,
patient warm
there is
while ensuring
in
privacy
case
while we're
of
cleaning the
spilling.
patient. You want to make sure you have one of those. If your patient doesn't want it, by all means, you don't have to use it though. Yeah. Now that our patient's covered, we're going to undo the gown. We're going to try and do it from underneath. We're trying to maintain
Just make
much
I'm going to
privacy.
push underneath you, okay? You're going to feel a couple little lumps.
Just like so.
Okay, now with the same process, I'm going to actually ask you
And I'll run it.
to please
Just like so.
turn the other way.
We're going to put
Again,
this
you're
in
gonna
this
be over
oiled
the
linen
little rolls.
basket.
Perfect. We're in the same process. Awesome. Thank you for helping me, but I would help you to move next time, make sure that nothing gets.
Okay, our next step is to get our wash basin, fill it with 2/3 full of water. Temperature should be tolerable to the patient, so make sure when you get your water, you ask the patient if it's too hot or too cold or just right. So in this case, let's assume my patient is okay with the imaginary water that's in my basin, and we're going to begin by washing the eyes.
I have my dirty linens equipment.
So without using soap, we're going to take our little washcloth into a mitt. So I'm going to get it wet.
No problem so far, Mr. Ham. Great.
We're going to start from inner, outer. Look at that.
Again, smoothing out the crease, make sure there's none.
Next, we're going to take another towel. We're going to dry. Just going to dab it dry. Just like so.
You can leave them
So
at
we're going to now tackle the rest of the face.
You can let go. Yeah.
So just make sure that you ask your patient if they want soap on their face or not. Soap can act as an irritant, so make sure you double check with your patient. For the purpose of this video, I will not be using soap. So we're going to wash with the forehead, circular motions, and with cheeks, and with the nose,
I'm going to my dirty linen.
and the chin, and the neck. Go in circular motion. And the ears. And we're going to rinse using another washcloth. Same steps.
Is that comfortable there?
Cheeks.
Perfect. I will also offer my patient. I'll
Nose.
give a patient a new sheet.
Chin. neck.
So make sure my patient has privacy,
Ears.
I would place this over.
Then we're going to dry her patient's face. Like so. Just want to softly
Hold on to this for me, please. Thank you.
softly dab their skin dry. Like so. The next step is to set the arms.
As I walk the
So
bag up with
as
the
you're doing
rail
this, I want to
Let me
remind
expect
you
now,
all
I'm gonna pull that other
that
sheet from
you're
under you,
supposed
okay?
to assess their skin for any redness, skin breakdown, any new skin abnormalities that may have developed. So with that said, our next step is to get
linen.
another towel. I'm going to put this underneath
Miss
the
McNair,
arm,
would you like me to tuck in your feet? Perfect.
just like
I'll
so.
do so for you.
I'm going to remove the bath blanket off to the side.
I'm just assessing.
Now we're
make
going to
sure
wash
that
from
there
distal
is
to
no
proximal
creases on
using
her
soap
line,
this
on
time.
her,
So just like
linen.
so. Soap on the washcloth. Holding their arm by the joints, so the wrist and the elbow. We're going to go from distal to proximal, so forearm first. I'll wash patient's upper arm.
Sleepy, are we?
And we're going to
Great. Great. So we're
gonna
getting some
rinse.
rest.
now for the upper arm, we're going to rinse. Circular motions. Okay, just like so. I'm going to dry these two parts first, the forearm
Would
and
you
the
like
upper
another
arm,
blanket mix right there?
No, this is perfect.
This is perfect.
before
Thank
I
you.
move on to the hand.
Okay, now that I've finished changing my patient's linen, I will go ahead and give her a cold bath. Take off my gloves and wash my hands. Also,
So we're going to move on to the hands. We're going to wash their hands for them,
and help her out.
like so. Soap once again. Distal to proximal, so fingertips down to the wrist. So I'm going to start from the inner.
Now that the
Going
bed has
down.
been lowered, it's safe for me to go.
Make sure you're getting in between the fingers.
Thank you, Ms. Manieri. Okay. Come on, get out. Get out right now.
Good thing I was
That's it.
Should I extend it?
Then we're going to rinse.
No.
In concept, that's what we've been doing before. Of course, keeping note of any redness, skin breakdown, and all that stuff. Now we're going to dry.
That's it. You're
Okay,
done.
that's one arm. All right.
And it's Fairfield, and that's it.
So we just want to make sure if the nails are dirty, you're going to use an orange stick to clean underneath the nails. But in this case, my patient nails looks great, so I'm not even going to bother cleaning them. But of course, you would still offer to do it for them, but you would not cut them. So we're just going to remove the towel from underneath, put the side roll back up, and bath blanket off to the side. We're now going to move over to the other side. Okay, just like what we did with the other arm, we're going to repeat with this arm again. So we're going to start with our washcloth. We're going to wash the forearm first, circular motion, distal to proximal, and the upper arm. We're going to rinse. Once again, distal to proximal. Make sure you also get underneath the axilla here. And I'm just going to pat this dry. Also, first underneath the axilla. Same thing with the hands. Distal to proximal. I'm going to wash. I'm going to rinse. And we're going to dry. Now once you're done with the arms, you're going to ask the patient if they have any deodorant or talcum powder, and you can apply it to their armpits, Then you would also apply lotion to any over their bony prominences and any over their dry skin. If they're ashy, just apply lotion to that area as well. So our next step, so we're going to now tackle the chest. Some patients prefer covering up one breast at a time. So for that exact purpose, we're going to follow through with that request. We're just going to expose just one half of the chest. We're going to take our bath towel. And we're going to cover it just like so. You're only exposing just the working area. So once again, soap, gonna wash, circular motion. Then you're gonna rinse. Just gonna pat this half dry. Then we're gonna do the same thing for the other half. Just like so. Once again, just gonna wash, circular motion. So they have like dressings just like these, like a central line or so. Just want to make sure you don't want to get that overly wet, or actually just don't get it wet in general. Just rinse. And then pat dry. And once again, applying lotion. The patient needs it. Next, we're gonna cover up the chest and work our way down to the abdomen. Once again, exposing only the parts that we're working with. Once again, wash. Circular motion once again. Also keep in mind you're also assessing for any skin abnormalities, so redness, breakage, any new wounds. We're going to rinse. Then we're going to pat dry. Just like so. Also done with the abdomen. Cover them up. We're now going to tackle the leg. So now we're just going to expose the leg. Since we're on the patient's left side, we might as well start with the left leg. We'll put the bath towel underneath. Once again, going distal to proximal with our washcloth. Just like so. Now we're going to rinse distal to proximal. Once again, assessing for any skin breakage, skin breakdown. We're also going to do the same thing with the feet. I'm just going to move my camera just so you can see it. Once again, going distal to proximal. I like starting at the interior portion of the foot, getting in between the toes as well, washing it. Now for the other side. And we're going to rinse. And we're just going to pat dry. Once again, applying lotion to any bony prominences. All right. And just for good measure, I'm going to dry this leg a little bit more, just in case I missed anything. I'm going to do the same thing for the other side. Suppose the leg we're working on. Again, we're going to take our bath towel, put that directly underneath the leg. Once again, holding their extremities at the joint. Next, going to wash. This is the proximal. And rinse, same way. Distal to proximal. Next, I'm just going to dry. Now, of course, if your patient has some blood clots on their legs, just be careful. You're not exerting too much pressure because you don't want to dislodge the blood clot. Final step is the foot. Once again, this is the proximal. We're going to wash, getting in between toes. This is the proximal. And we're going to rinse. This is the proximal. We're just going to pat dry. So if our patient is we're also gonna lotion up their leg, especially if they are diabetic, because they may have foot neuropathy, and you want to make sure that you do proper foot care, especially in diabetics. And next up, we're gonna assist a patient to turn over, and we're gonna assess the back and buttocks, and we're also gonna wash their back. So I'm going to put the head down. Alright, I'm going to put this side roll down. And while covering up our patient, I'm going to try and assist our patient over to the other side, just like so. So we're going to, I know this is a manikin, so it's going to be a little bit difficult. So we're going to assess for any redness on our patient's skin, on the back, skin breakdown. So we're just going to wash the patient's back in a circular motion. Once again, changing water if necessary. If the water has gone lukewarm or whatever, every time you're moving in between systems. So from the arms to the chest, from the chest to the abdomen, or abdomen to the legs, legs over to the back, you would change the water, whenever you're changing, body parts. So in this case, I've done so. Quote unquote done so. So we're just gonna, wash the back in a circular motion. We're gonna rinse. Now, of course, you would want to put on the bath blanket as close as possible before you begin. So let's redo that. Take this, I'm gonna wash the back, circular motion, assessing for any redness, skin irritation, and possible skin breakdown. And if you notice anything different, keep that in the back of your head. Just continue on cleaning, and then you're going to document your findings once you're done. Okay. Next up, we're going to rinse.
Excuse me, I leave at 3. I'm leaving at 3:30. I don't have time to do anything. Why you guys up so late? No, 3:30 and I gotta leave.
dab them dry. Then, if needed, apply lotion. Give them a back rub while applying on the lotion. It's definitely going to feel really good for the patient, and they'll appreciate that very much. So, once we're done, we're going to remove this bath towel. And we're going to assist the patient back down. So. And then we're going to clean our patient's perineal area. You also want to keep in mind when you're doing the perineal area, if they have a Foley catheter or any type of indwelling catheter in there, that you also want to clean the catheter as well. So, for the purpose of this demonstration, we're just going to expose just the working area. Like so. Just on the working area for the purpose of this video. In reality, you really wouldn't see this. It'd probably be looking like this. But for the purpose of this video, just so you know what I'm doing. So we're gonna, without any soap or with soap, according to what the patient wishes, we're just gonna wash very gently, going from front to back. For you ladies, this is common sense. For us guys, not so much. So we're just gonna quickly wash. With or without any soap. If the patient wishes for soap, go with unscented. Because the scent will definitely irritate the patient. So once again, now we're just going to rinse, dab it on, because it's a very sensitive area. Then taking our towel, we're just going to pat it dry. Just like so. Next, we're going to cover up our patient once again. Now, of course, if the patient had a catheter, you clean the site from where it enters through the urethra, and you would clean that all the way down. But since my patient didn't have that, I'm not going to show you. Okay. We're going to raise the head up, our patient once more, and we're going to address our patient. What I like to do is I like to slip on the gown over and see it. And since these don't have snaps, they just have the regular sleeves, we're just going to have the arms just slip right through. Then we're going to take the bath blanket from underneath her. So, 1. 2. While holding on, I'm going to take that. And this can go over to the soiled linen, that bath blanket. Our next step is that we're going to cover our patient and make the bed as neat as possible. That's just the way how we found it. If they want any of the linens changed, this is when we would do so. Then we would offer our patient if they want their hair combed, give them the cowbell light, ask them if they need anything else, and that'd be it. If they want a comb, just take a comb and just quickly comb them. Once you're done, like I said before, cowbell light, then we're gonna ask them if you need anything else. Put the bed back down, back to its lowest position. and then the head at the angle that they wish. So in this case, I'm just going to put the head all the way back down. That's it. That's how you give your patient a bed bath. And remember, if you found any abnormalities, you want to document too. So thank you for listening on how to do a bed bath.